Hello and welcome. Today, we're diving into a common yet often misunderstood condition affecting women's cervical polyps. These small growths on the cervix can sometimes cause concern, but understanding them can help you navigate any potential health issues with confidence. So, what exactly causes cervical polyps? The exact cause remains somewhat elusive, but several factors are believed to contribute to their development. These include chronic inflammation of the cervix, abnormal responses to estrogen levels, and even clogged blood vessels in the cervical area. Infections and pregnancy can also play a role in some cases. However, it's important to remember that cervical polyps are usually benign, meaning they're not cancerous. To understand how polyps form, let's look at the pathophysiology. The cervix, the lower part of the uterus that connects to the vagina, is lined with both glandular and squamous cells. When the cervical tissue becomes inflamed or irritated, these cells can proliferate abnormally, leading to the formation of a polyp. Imagine it as a small outpouching or growth of the cervical lining. These polyps are typically attached to the cervix by a narrow stalk, similar to how a mushroom is attached to the ground. Cervical polyps are relatively common, particularly in women who have had children and those who are perimenopausal or postmenopausal, typically between the ages of 40 and 50. While they can occur in women of any age, they're less frequent before menstruation or after menopause. The precise prevalence varies, but studies suggest that they are found in anywhere from 2 to 10% of women. Fortunately, cervical polyps are rarely cancerous. Many women with cervical polyps experience no symptoms at all. In fact, they're often discovered during routine pelvic exams or pap smears. However, some women may experience abnormal vaginal bleeding, such as spotting between periods, heavier periods, or bleeding after intercourse. Unusual vaginal discharge is another possible symptom. It's important to note that these symptoms can also be associated with other conditions, so it's crucial to consult with a healthcare provider for proper diagnosis. Diagnosing cervical polyps typically involves a pelvic exam. During the exam, your doctor can often visualize the polyp directly. A pap smear may also be performed to screen for any abnormal cervical cells. In some cases, a colposcopy, a procedure that uses a magnifying instrument to examine the cervix more closely, may be recommended to rule out other conditions, such as cervical dysplasia or cancer. A biopsy, where a small tissue sample is taken for microscopic examination, is the definitive way to confirm the diagnosis and ensure the polyp is not cancerous. While there aren't strict classifications or types of cervical polyps, they are broadly categorized based on their location and appearance. Most are endocervical polyps, arising from the cervical canal. They can vary in size, ranging from a few millimeters to several centimeters. They are often reddish, purple in color, and have a smooth, grape-like appearance. Some polyps are also described as fibroid or adenomatous, reflecting their cellular composition. However, regardless of their appearance, it's important to determine if any atypical cells are present. Treatment for cervical polyps depends on factors such as size, symptoms, and risk of malignancy. Small asymptomatic polyps may not require any treatment, but regular monitoring is essential. If treatment is necessary, the polyp can be removed during a simple outpatient procedure. Common methods include polypectomy, where the polyp is twisted off or excised with forceps, and electrocautery, which uses heat to destroy the polyp and prevent recurrence. In rare cases, a hysterectomy, or removal of the uterus, may be considered if the polyps are very large, numerous, or associated with other uterine conditions. Following polyp removal, the tissue is typically sent for pathological examination to rule out any cancerous or precancerous changes. Unfortunately, there's no guaranteed way to prevent cervical polyps entirely. However, you can reduce your risk by practicing safe sex to avoid sexually transmitted infections, which can contribute to cervical inflammation. Regular pelvic exams and pap smears are also crucial for early detection of any cervical abnormalities, including polyps. Maintaining a healthy lifestyle and addressing any underlying conditions that may contribute to chronic inflammation can also be beneficial. The prognosis for cervical polyps is generally excellent. Most polyps are benign and easily treated with complete resolution of symptoms. Recurrence is possible but not common, and regular follow-up appointments with your healthcare provider can help monitor for any new growths. Research continues to explore the underlying causes of cervical polyps and to develop more effective diagnostic and treatment strategies. Recent advances include improved imaging techniques and minimally invasive surgical approaches, making diagnosis and treatment even easier and less invasive. Thanks for watching.